Homunculus. Some important information. Anterior cerebral artery supplies paracentral gyrus. If it is compromised, there will be motor and sensory loss in the lower limb, pelvis, and perineum region. Middle cerebral artery supplies the lateral part of cerebrum. If it is compromised, there will be motor and sensory loss on the face. And if branches of middle cerebral artery are compromised, sensory and motor loss may occur in upper limbs as well. Functional areas of cerebrum. Broadman areas are seen on lateral view. Area 4. It is the precentral gyrus. It is the primary motor cortex or frontal motor cortex. It is controlling the skeletal muscles of the body. It is represented via the homunculus. Lesion of this area, like middle cerebral artery thrombosis, causes contralateral hemiparesis in the affected area in accordance with the homunculus pattern. Area 1, 2, 3. It is the post-central gyrus. It is the parietal sensory cortex or the primary somatosensory cortex. Lesions of the area causes contralateral loss of touch, vibrations, or stereognosis in the affected area in accordance with homunculus pattern. Area 17. It is the occipital visual cortex or primary visual cortex. Lesion of this area causes hemianopia, visual field deficits. Area 41-42. It is the temporary auditory cortex or primary auditory cortex. It is present deep to the temporal bone at superior temporal gyrus. Area 22. It is the Wernicke sensory speech area or auditory association cortex. It is present posteriorly on the superior temporal gyrus. Lesion of this area causes Wernicke's aphasia. Wernicke's aphasia. The patient is not able to understand the spoken or written language. Area 44-45. It is the Broca's motor speech area. It is present in inferior frontal gyrus. A lesion of this area causes Broca's aphasia or expressive aphasia. Broca's aphasia. Speech becomes difficult, but patient understands the spoken language. Area 8. It is the frontal eye field. It is present on the middle frontal gyrus. It helps in coordinating the medial rectus of one eye with lateral rectus of other eye for horizontal gaze movements. Lesion in this area causes problem in horizontal gaze. Cranial nerves. There are 12 pairs of cranial nerves. Cranial nerves 1 and 2 originate from forebrain. Cranial nerves 3 to 12 originate from brainstem, that is midbrain, pons and medulla. Cranial nerve 1, nerve of telencephalon for smell pathway. Cranial nerve 2, nerve of diencephalon, optic nerve for visual pathway. Cranial nerve 1, olfactory nerve or nerve of telencephalon. It terminates at olfactory bulb. It is the pathway for smell. Cranial nerve 2, optic nerve or nerve of diencephalon. It comes from retina of the eyeball. Cranial nerve 3, oculomotor nerve. It originates from upper midbrain. Cranial nerve 4, trochlear nerve. It originates from lower midbrain. It is thinnest cranial nerve. It is only cranial nerve which exists from dorsal side of brainstem, then lateral comes ventrally. Cranial nerve 5, trigeminal nerve. It is the thickest cranial nerve. It originates from pons. It has 3 divisions: ophthalmic, maxillary, mandibular. Cranial nerve 6, obtuscens nerve. The nucleus is in the pons, but it emerges from pontomedullary junction. It is the most medial nerve. Cranial nerve 7, facial nerve. Cranial nerve 8, vestibulocochlear nerve. Nerves arising from pontomedullary junction, medial to lateral. Cranial nerve 6, 7, 8. Nerves arising from medulla, posterolaterally from olives. Cranial nerve 9, 10, 11. Cranial nerve 12, hypoglossal nerve. It controls tongue muscles.